It was good. I didn't do anything exciting because I've been working on so many projects.
Yeah, did you study the tobacco stuff at all?
I did sort of, but I had so many other things that I kind of just didn't want to pass it, so I couldn't do it.
Definitely. I still like being here.
I don't either. How was your weekend?
It was okay.
Yeah. Did you go out? Fast?
Okay, welcome to class today. We're going to start as always with our pause practice, 30 seconds. We're going to focus on your breathing, focus your awareness in today, bring yourselves into today's classroom, okay? So we're going to go ahead and start. Jogging.
Jogging. Oh.
Gotta go faster, Svetlana.
Are we done yet? This is a really long time jogging.
Okay, thank you. Welcome to class. So to start today, we're going to do some review on last week's lecture for tobacco cessation, as well as some communication activities today, okay? So,
Wait, what are we doing again?
Communications. Okay. So, to start, what I would like to do is have two volunteers come up to the front. You would want to wait till... We're going to do some. Okay, so I'll have two volunteers come up to the front and kind of demonstrate what we reviewed last week, what we went over our lecture, some effective communication. So is there any volunteers who'd like to go first?
Oh, yeah, we get it over with.
Okay, Svetlana, go ahead and join Lindsay. So I'll have Svetlana be the patient. Svetlana is a smoker, and Lindsay, you will be the clinician tonight.
Okay.
So go ahead and just start whenever you're ready.
How are you today?
Thank you for coming.
It's nice to see you. I haven't seen you for 6 months.
Thank you.
Is there anything new or exciting in your life that you want to tell me about?
Not really.
How about in your mouth?
You know, I have some stains and like it to clean.
Stain?
Like, yeah.
Oh, what'd you get stained from? Not cigarettes, right?
Actually, yeah.
You smoke?
Yes, I do.
You smoke?
Mm-hmm.
How long have you been smoking for?
Maybe about 8, 9 years.
I hope you know that that's really bad for your health, as well as your mouth.
I do. But
People don't like to look at stain.
I
A
know.
lot of people think it's really, ooh, not cute.
I know.
Yeah.
But just
So why do you stop? Are those cigarettes in your pocket? Can I see them?
Do you want some?
Yeah. No, let me look at them. You shouldn't. You shouldn't. That's way for
Oh,
the.
you know, it's $3, you know?
That's $3 you could have saved yourself. You shouldn't be spending it on cigarettes. You have a child. Do you know what? Because you told me. Do you know what that does to your child? Not good. Do you know what it does to your mouth? Oral cancer, probably
You
instantly.
know what? I'm
It's
sorry,
okay, it's
but
okay.
I won't come back to your
If you don't want to listen to you, that's fine.
Nice.
It's your mouth.
Thank you. Thank you for your information. It's not nice.
Is that okay?
Actually, we probably have some review
Oh,
to do.
Okay.
So, is there any feedback that anyone else would like to possibly give to Lindsay?
That
was horrible.
She was like super rude.
Okay.
I thought I did really good. I thought I asked really good questions. They were all open-ended. I was super friendly. I mean, if she's a smoker like that, how are you supposed to be nice to a smoker?
Well, you know, that's where your judgment comes in. You got to put your judgment aside.
And not be so
want to-
pushy.
Exactly. There's ways to ask questions.
Oh, you guys should try it.
We will, and we'll do it right.
Okay. So, I I guess what we'll do is.
Can we review that, I guess, a little bit? Can you
Yeah.
tell me how I'm supposed to do it?
Yeah,
Because obviously
absolutely.
I missed it.
Yeah, so
Okay.
most importantly, open-ended questions and avoiding you statements. Lindsay did a lot of you this, you do this. We want to avoid that. We want to put ourselves in the patient's shoes and kind of present to them what our concerns are, not really blaming them for anything that they do. Nonverbal communication is very important. Lindsay was very, dramatic with her statements and her body language. We also want to help the patient co-discover their own problems. Showing the patient the stain and having them see it themselves would have been a better way of going at it instead of telling them that the stain is gross. We want to establish a trust and support with the patient, and that obviously didn't happen in that communications. Most importantly, you want to do some pause practice. Remember that silence is golden. You asked your questions very rapidly and didn't have the patient give time to respond. So,
Okay.
if you would have maybe listened a little bit more what she was saying or what her thoughts were about it, then you may have been able to come up with a little bit better questions. Okay. So what I would like to do is have any other volunteers come up who may be able to kind of show us a better way of going at that. If anyone? Okay, Stephanie Brogan, go ahead and come up.
Good luck.
So we will have Stephanie be the patient tonight. We will say that she is a chew tobacco user, and Brogan, you can go ahead and be the clinician, okay? And you guys can start whenever you're ready.
Well, now that we finished your EOIO, I have some areas of concern. I saw the tissue right around your lower into your teeth is not as healthy as the rest of your mouth, and there's some stain around there. And I know you said that was one of your concerns, was the stains on your teeth.
Yeah, I have really bad stain, and I don't really know what it's from. I mean, I chew tobacco every day, but
That could definitely be a contributing factor. Have you ever thought about quitting? Are you interested?
I've thought about it. My husband really wants me to quit because he thinks it's kind of gross. But I don't really have a good reason. I don't know what it does to me or anything, so I mean, why quit?
You know, honestly, it is just overall health of your mouth is going to be affected, the tissues in that area, because of the recession. So you could suffer from teeth loss, and it definitely raises your risk of oral cancer. And that's one thing we're really concerned about. That's why we do the EOIO every visit.
Well, that's a good reason. So you're saying the stain is caused by that also?
Yeah.
Oh, well, yeah, maybe I should quit. I think I do want to quit.
You? All right. Well, that's great. I'm sure your husband's going to be really excited. We actually have these pamphlets for the Arizona Smokers Helpline, and they have a whole bunch of products. They have counselors, support system, and they're just a really great. It's free, so they're just a really great program. So I can give this to you, and you can get in contact with them. Also, when you come back in 3 months, we'll definitely go over it and see how it's going for you.
Okay, thank you.
Sure.
Okay, that was beautiful.
That was pretty good.
Beautiful.
Beautiful.
Beautiful. Okay, so I guess just a few things that I'll go over before we end class today. A few key important things. We always want to remember to ask open-ended questions to our patients. Let them have a chance to give us information. Avoid you statements like I mentioned earlier. We want to help the patient co-discover their own problems. So through the EOIO, like Brogan had mentioned, we will help them to recognize the problems that they could be having. We want to identify their motivation in the area, whether they're willing to quit or they're not interested, what their IQ is about, their knowledge about tobacco use and how it affects them orally and systemically. Their values, their healthcare values, and any fears that they may have. We want to remember the 5 A's. We'll ask the patient, we'll assess through an EOIO. We will advise them about their health. We want to assist them in possibly getting some information to quit, and then we will arrange for them to possibly, call up a smoker's helpline or to get some information for them to help that process. We want to remember to take pauses. Silence is golden, so we want to ask a question and let the patient respond. Give them enough time to come up with a response on their own. And finally, just remember that we're facilitators, so we are going to help them. We're going to bridge that gap between them, and we're going to plant the seeds. So we will give them information and leave it at that, and let the patient decide from that point what they want to do.
Do we bring it back up at the next appointment when we see them?
You can mention it to them. You don't want to be forceful to them, so don't be judgmental. Leave all of your feelings at the door when the patient comes in. But definitely mention it every time that they're in. Sometimes things change, life events happen, and they may decide that 6 months down the road that they're ready to quit, and they would be interested in getting some information from you at that time. So those are some key important things to remember. Other than that, you guys did great. I appreciate it.
Thank you.
Thanks.
We'll see you later.